Welcome to the Clinical Eye Openers project and how-to series. There is a separate introduction about the clinical eye openers that I invite you to see. The how-to series consists of modules that emphasize the recognition of signs and their clinical significance. If you are interested in who I am, please come back to this frame and read at leisure, but I must proceed in the interest of brevity. All clinical eye opener modules adhere to the same credo and aims, summarized here. Fundamentally, we select the most provocative images in order to call your attention, show you how to transform signs into signals through understanding, how to synthesize signals into clinical tips and pearls so that it impacts the quality of clinical care, to emphasize the precision and clarity of expressions in English medical terminology by a stress of the ideas inherent in these terms. We mix all of this with a generous dose of humanism due to the fact that this is essential for medical ethics and clinical medicine. And all of this then we try to do in an entertaining and stimulating manner. Along the way, there are many words shown in red, which is indicative that these are key terms, and generally they are explained in endnotes in each of the modules. Here is a panel of provocative images to underscore what the Clinical Eye Openers project is standing upon. This is the core. And once you are familiar with the essential elements through micro tutorials, the program will stress a very short and brief style of communication. A picture, a discussion of signs, interpretation of signs into signals, interpretation of clusters of signs and signals into syndromes, and synthesis of syndromes into a potential cause, etiology, and finally a synthesis toward a hypothetical diagnosis. So to end this brief introduction of how-to series in the Clinical Eye Openers overall framework, I like to stress briefly that the art and science of detecting signs, understanding them as signals, clustering them into syndromes, etc., is the discipline of semiology, a word that is no longer very popular but nonetheless essential. The how-to series starts with the face, which is composed of 5 modules which you can see in 2 versions. One is a basic version and the other is a full version or expanded version. Access to the basic version is entirely free, and access to the full or expanded version requires that you register in Pandora Wordbox. You can do so by returning to the website from which you arrived or by clicking on the link. Please register now or visit us soon again, and until then, best wishes from all of us.